Hello and welcome, ladies and gentlemen, to our presentation of palliative care sponsored by the Cruces Palliative Care Coalition. My name is Terry Meyer. I'm a physician and the chairperson of the coalition. I have long been interested in supportive care for patients with chronic serious illness. However, over the past few years, I've become more interested in the modern-day definition of palliative care. Typically, hospice patients are required to accept the concept of terminality or limited life expectancy and are expected to forego any cure-directed therapy or life-prolonging therapy. While this might be an easy exercise for some patients and their doctors, it becomes quite an existential dilemma for a certain percentage of patients. Thus, palliative care has evolved as a response to this dilemma, as well as additional reasons. Now, let me share some of the general characteristics of palliative care. Clearly, as mentioned above, there's no requirement to be terminal or forego any cure-directed therapy. In fact, we advocate that palliative care starts at the beginning of a diagnosis of a chronic serious illness. Palliative care provides an extra layer of support, including a holistic approach to the care of the patient, addressing not only the physical, but the psychological, social, socioeconomic, and spiritual dimensions of the patients. It clearly emphasizes a team approach. Communication skills are greatly emphasized in palliative care. While the patient and family members might expect healthcare providers to have excellent communication skills, these skills are extremely important, especially when dealing with patients with chronic serious illness, as well as breaking bad news, if you will. We also assist the patient in defining their own healthcare goals. We advocate that these healthcare goals be respected by the routine healthcare delivery system. Additionally, the concept of quality of life versus quantity of life is extremely important in the palliative care picture. We constantly reflect on the issue of not only what could be done for a patient, but what should be done for a specific patient. Patient satisfaction, family member satisfaction, and caregiver satisfaction, as well as referring physician satisfaction, are an important dimension which we address routinely.
Palliative care is a specialized type of healthcare. In palliative care, we focus on the patient's quality of life as they work through their curative therapies and treatments for their serious illness. Palliative care consists of a team of qualified healthcare professionals that work together to support patients and families in any way that we can. For example, at Memorial Medical Center, our team consists of myself as the physician, a clinical pharmacist, a nurse practitioner, a social worker, and a chaplain. Together, we all help patients deal with multiple needs. These include symptoms from treatments or diseases. These include things like unmet social needs, psychological or spiritual needs. And we also help patients and their families plan for the future. Palliative care does not take the place of your other healthcare professionals. Instead, we work together as consultants to help support your healthcare professionals as they help you with your disease. Our medical system has become increasingly complicated, and it can be difficult for patients and families to navigate when they're faced with a serious illness. Palliative care is there to walk with you along the way.
Receiving palliative care does not mean you are dying. Ideally, palliative care starts at the beginning of a serious chronic illness. At least 12 million adults and 400,000 children have serious chronic illnesses such as metastatic cancer, severe dementia, heart failure, and serious congenital illnesses. While hospice specifically is palliative care at the end of life, it's only part of the palliative care picture. Hospice care is the smaller circle representing end-of-life care, while the larger circle represents palliative care potentially valuable to approximately 4 to 5 times the number of patients who are eligible for hospice care. While palliative care takes into account the disease, it's not about treating the disease. It's about treating the person. It's about helping symptoms and helping improve quality of life. Of course, palliative care is not about shortening life, but it's not specifically about prolonging life. It's about making each day as good as it can be.